My name is Gaetan Moise. I'm one of the board-certified neurosurgeons here at Neurosurgeons of New Jersey. I've been here for about 10 years. I started in 2010, and my specialty is spine and Chiari. One of the things that I think most of the surgeons here at Neurosurgeons of New Jersey pride themselves on is a very conservative attitude toward surgery. We tend to believe that surgery is the last resort. Oftentimes, patients will do better if they end up being treated through non-surgical techniques. Most patients that I see, we will have a diagnosis early, but we will hold off on surgery until they've exhausted every other option, except in cases of emergencies such as tumors, which we occasionally see. 70 to 80% of the patients that I see in consultation never end up even needing surgery and can go on to lead productive lives. And most of my patients are appreciative of is actually the staff here at Neurosurgeons of New Jersey. So, I get countless reviews where patients will tell me directly, oh, your assistant was amazing, the nurse who called me was fantastic, the people who prepared me for the operating room had every question answered so that when I went into the hospital I wasn't worried about anything at all. Most patients appreciate is an understanding of where their symptoms are coming from. So the first step, I think, is if they can understand their problem in the context of the imaging, that helps settle things a lot. One of the things that happens just because the spine bears a lot of wear and tear is if you took 100 people on the street and you did MRIs on all of them, you'd find herniated discs, you'd find arthritis, you'd find degeneration all over the place. And most of those patients are walking around without symptoms. Most patients can understand this stuff if it's broken down in a way that doesn't use the medical jargon and verbiage. And so I find that first step oftentimes will then allow them to understand what our therapeutic pathway is. So when we say, well, we're going to do an anti-inflammatory because we see that nerve is inflamed, or when we say we're going to do physical therapy with some manipulation to see if we can take the pressure off of that nerve by shifting that disc back into position, or if we say we're going to send you to pain management and have them try a steroid shot, they understand what the purpose of that is. And so both understanding their symptoms and understanding the treatment pathway, I find, is very helpful for clarifying what's oftentimes a complex situation.